Next, New York prosecutors have announced new charges against the man suspected of gunning down a health insurance CEO, including a charge of second-degree murder as an act of terrorism. Luigi Mangione is also facing 10 other charges after the fatal shooting of Brian Thompson outside a hotel in Manhattan. The city's police commissioner also warns against what has been a morbid wave of appreciation and celebration of Mangione after the killing, particularly with regard to the U.S. healthcare system. Lauren Bersticker has this report.
Already charged with murder in the first degree, Luigi Mangione, the man suspected of killing the CEO of UnitedHealthcare, will now be tried on terrorism charges.
This was a frightening, well-planned, targeted murder that was intended to cause shock and attention and intimidation. It was intended to evoke terror, and we've seen that reaction.
Mangione allegedly shot UnitedHealthcare CEO Brian Thompson as he was headed to an investors' conference in Midtown Manhattan on December 4th. After a 5-day manhunt, the suspect was arrested in Pennsylvania, still in possession of the murder weapon and of a letter that denounced corporate greed in the health insurance industry. And while the 26-year-old's motivations remain uncertain, the killing unleashed an outpouring of anger against the U.S. healthcare system, with many sharing stories of being denied coverage or left with massive debt. Some social media users even portrayed the killer as a hero, setting up a fundraiser to pay for his defense, while wanted posters featuring other health insurance executives began appearing on New York streets. On Tuesday, the city's police commissioner slammed these reactions and warned against glorifying murder.
Let me say this plainly. There is no heroism in what Mangione did. This was a senseless act of violence. It was a cold and calculated crime that stole a life and put New Yorkers at risk.
Mangione is currently being held in a Pennsylvania jail and said he would fight extradition to New York, where he faces a maximum penalty of life in prison without parole.
Well, as we've been mentioning, there has been an unsettling glorification of Luigi Mangione, with some calling him a 21st century Robin Hood. His actions have sparked a wider debate about the state of health insurance in the United States. Let's get more on this from Greg Shaw, who's a professor of political science at Illinois Wesleyan University. He's also the author of The Dysfunctional Politics of the Affordable Care Act. Greg, thanks so much for joining us on the program. Clearly, there's been a lot of anger and frustration with the U.S. healthcare system. Give us your reaction to this morbid wave of appreciation and celebration of Mangione and this murder.
Yeah, I think it's probably important to keep in mind, if you take the long view, that corporate greed is not a new thing, right? And so if instances of corporate greed were enough to trigger enduring social movements, I think we would have seen that already. It's not, while this is a horrific murder, planned as it was and so forth, I'm not sure I see here the makings of a narrative that will, highlight this particular industry for sweeping reform. I don't think the culprit is quite that clear as some would think right now. So I think midterm, what we will probably see is more consumer upset about medical debt, but that the fault for that goes in a variety of directions, not simply toward the insurance industry.
Well, Greg, we'd love you to just explain to us some of the flaws in the US's healthcare system, because, of course, the US is one of the world's wealthiest nations, yet it seems to be one of the weakest in terms of coverage in its healthcare system. Tell us why.
That's right. So currently, and for the last several years, we've had about 9% of Americans remain uninsured with no health insurance. And, they cobble together care however they can by showing up at emergency departments at hospitals with no particular ability to pay and so forth. And the system just has to eat that. So it's a long story, but it has an awful lot to do with the idea that there's a cultural element here, that we in the U.S. have nurtured this individualism myth that we're all somehow individuals responsible for our own care. So that works against collective efforts. There's also a very inefficient public-private partnership that goes on around healthcare financing. So in brief, we have a lot of private providers who are profit seeking, but who are paid through government systems that have very little ability to put downward pressure on prices. And so basically, there are a lot of private providers out there who, despite their ability to deliver really excellent care sometimes, are in it for the money for the most part, and government has very little ability to tamp down on that. So that's a big part of it right there. And we spend an obscene amount of money on healthcare. And this year, the average American will spend about $14,000 on healthcare, and that's ridiculous given the mediocre health outcome data that we achieve as a country.
Yeah, that's a staggering amount, Greg. Pretty much
It is.
every developed country in the world is committed
Right.
to universal healthcare. You spoke up just about how the US has this individualistic stance. Is universal healthcare something you want to see coming in force in the US? Do you think it's even possible for the US to do that?
Yes, I would love to see that. Is it possible? It's sort of like achieving social justice generally. It's a little piece at a time. It's a long-term project, and we're gradually getting there. In the last decade, we've made a significant stride in that direction. Going from about 17% of Americans being uninsured down to about 9%. So, but there doesn't seem to be much of an appetite for universal, if by that we really mean 100% of people covered. And that, again, is because of some of the incentives that are baked into our system. And, the story of private insurance in this company goes back to the advent of the industry back in the 1930s and 40s. And so to take on that industry now and say, we're going to do something like a Medicare for all or something like that, universal, that would wipe out the healthcare industry, is to take on a multi-trillion-dollar industry, and that seems I won't say impossible, but certainly improbable in the near term. I think we'll continue to stagger along with the patchwork system that we have.
And Greg, just a final word from you. Donald Trump is going to be returning back to the White House in January. That's
Right.
likely to bring changes that could possibly scale back the US's public health insurance programs. Tell us about the impact that Trump will have once he gets back into the White House.
Yeah, so that administration, like the first one, will probably be an exercise in loosely controlled chaos, and disruption more than anything else seems to be his brand. I don't know that he even has the concept of a plan, as he would tell you about healthcare reform. But I think what we'll most likely to see, rather than an outright effort to repeal the Affordable Care Act, I think you'll see a scaling back of assistance to help people take advantage of the healthcare insurance marketplace that the law created. I think you'll see a scaling back on various public health programs, perhaps prominently vaccine programs. And so I think the core of it is very likely to succeed, if for no other reason that we have literally tens of millions of people now who rely on that law to either get Medicaid, that is the program for lower income Americans, or subsidized insurance on the online exchanges. And so I think we'll see a slight notching down of enrollment because government will do less. This administration will do less to help people see their way clear. But I would be surprised if the administration takes on the fight of trying to repeal the law outright, given how embedded it is.
Greg, great to talk to you. Thanks so much for giving us your insight there. That's Greg Shaw, who is a professor of political science and also the author of the Dysfunctional Politics of the Affordable Care Act. Thanks so much, Greg. Let us move on because it's time